Where we are born, grow, live, work, and age impacts our health. Those of us who work as healthcare providers in rural and urban areas face unique patient care challenges related to non-medical factors such as whether our patients have transportation, safe and healthy homes, access to healthy food, and enough money to pay for housing and medical care. Each of these factors influence health outcomes.
The Connecticut Area Health Education Center's Urban Service Track is a program that's designed to address those non-medical as well as medical management issues for different vulnerable populations. Students come together in a cohort of approximately 60 from various disciplines and institutions, and they include medicine, dental medicine, nursing, pharmacy, physician assistant, and of course, social work.
The pillars of the Urban Service Track are interprofessional education, team-based care, and community service. We achieve this by letting our learners go through training, beginning with learning retreats, clinical skills boot camp, and then going out into the community doing a variety of health promotion activities in other places where we might be of service to underserved communities.
Primary care is a central component of the healthcare system. And the topics that we discuss here in the Urban Service Track are specifically centered around very important issues that affect both our urban and rural populations, the same populations that our learners will be working with throughout their careers.
I think especially in the pre-clinical years as a medical student, we're up in the books, we're in lecture, doing more case reports of very specific disease processes and pathologies. And while it's really interesting to have that type of learning in school and foundational to my learning, I think UST pairs so nicely because it's able to actually put me into the community, see people, and understand exactly what they're going through. I think it just adds a lot of color to the stuff I'm already learning, and it's really crucial to having a more holistic approach of learning medicine, understanding community needs, and understanding that medicine isn't just the pathology you see on a page, but rather the different socioeconomic barriers that people might face as well.
So today we are at our Veterans UST Learning Retreat. But of course, veterans aren't the only special population that we focus on. Some of our retreats focus on people with a history of homelessness, LGBTQI immigrants, and refugees. And our students come together and we break out into groups and we work on cases together. We have people from the community who work with these groups on a daily basis. We have special panels, and then at the end of the retreat, we come together, we summarize, and then we all enjoy a nice meal together.
What I got out of the retreats are the variety of student perspectives that are shared during our meetings. It's really valuable to see how we all think about the cases that we see and how we all think differently about it.
Each student has 2 or more community events per semester. So sometimes we go out into schools and teach oral hygiene education. Sometimes we go to senior centers and teach about lung function and smoking cessation. For example, today I'm at the Black Family Wellness Expo in Hartford, where we're doing all of our screening services, our blood pressures, our blood glucose, our dental hygiene education. I think it instills confidence. I think it gives them skills that they don't get in their regular curriculum, and I think it allows them to connect to other colleagues in different health professions and other community members and potential patients that they wouldn't necessarily see in some of their regular placements.
The excitement of an Urban Service Track is palpable. To watch our students, to watch our teaching corps, to watch our community partners come together with a sense of purpose and passion, it doesn't get better than that.
UST is a family of passionate people who serve their communities and really care about the individual person.
I really like UST because I'm able to get out in the community and practice all the skills I'm learning in school, and it also allows me to talk with all the other healthcare disciplines and really be able to communicate on a team.
I joined UST because I knew that so many patients, they have a story, and they have stories that go way beyond what they initially tell you. And some of us healthcare providers need to listen to these people and figure out what really their needs are. I know that by being a part of this program, it's going to help my patients from here on out, and it's going to create a ripple effect that I'm proud to say is thanks to UST.